Hi everyone. This is my first meeting, so I hope it goes well, and I hope I can share all my experiences that I have learned from others, my seniors, and along this journey. So I will share some tips how to match into pediatrics as an IMG, and yeah, we'll get started. Do you want to go to the next slide, Shanti? Okay. So some of the important things, as for any specialty that you apply, scores are the biggest thing because they use them as a criteria, one of the criteria to screen applicants. So prepare well in advance for USMLE scores. Get really good. I will discuss more about it in my next slides. And these are some of the things I will be discussing in my next slides about what are the things you can consider doing for making a good application. US clinical experience, research, your letter of recommendations, personal statement, CV, and when the time comes, making a list of programs, applying on time, and writing letter of interest emails, interview prep, and communicating with programs, residents, and networking. Can we go to the next slide, please? So I included some statistics from the last match in 2022. This was not the recent one. I couldn't find the 2023 statistics, but this is from last year. As you can see, I think the total number of non-US IMGs that were matched that year into pediatrics were about 350, out of which only 276 of the applicants in the matched portion, you can see there's 276 people, only gave consent to use their information. So from that pool, the mean USMLE score step one was 229. I know now it's like pass or fail, but the step two score was 240. So try to get like good scores at least in 230s or 240s to be able to be like a strong candidate. And if you get more, that's really well and good. So this is like mean average. It doesn't mean that if you got lower than this that you won't match, because some programs do consider like holistic review of applications to see how if you have done any research, if you have done any rotations. As you can see in the next measures that in the same picture here, people have done research, abstract presentations, publications, and volunteering experience. If you have another degree like MPH or something, everything counts. Everybody is unique and different. So scores are the biggest thing. Can't stress enough on that. So make sure you get good scores, prepare well in advance. Can we go to the next slide? Okay. So yes, sorry, can I see it? No. Okay, this is perfect. Thank you. So as I said, I have been on the both sides in your shoes few years ago, and being on the other side too, they definitely look into USMLE scores while screening applicants. So please make sure you get ample time for preparation, and there's tons of resources like what to use. And I took my exams few years ago, so I might not be the most newest person, but I think those resources that I used was UWorld. UWorld I did like multiple times. That's like the best resource that is available, and rest of it like first aid, pathoma. I think AMBOS is also a good one, I heard. Prepare well in advance, and I think finishing step 3 prior to residency application will definitely be helpful if you are like old grad, let's say 3 or 4 years out of graduation, or somebody who has red flags. It does make a difference, because pediatrics in step 3 you cover like all subjects, right? Just better to get done with it. Who wants to take this exam and do questions on IM or FM while in residency? It's hard. So it's not easy. So getting it out of the way is helpful for your own, good, and also for the application. So I strongly recommend finishing step 3 right after your CK, because the questions are almost similar. And I think taking it back to back is really a good thing to do. US experience, a lot of people, I don't know, from what I've heard and seen, use pediatrics as a backup option. If it can be evident in your CV if you do all rotations in IM, and maybe just do like one maybe or no rotations in pediatrics at all, and apply for pediatrics as a backup. That's not like a good sign. You might not be getting interviews. because pediatrics, the program directors really want you to have interest in that field. And so please make sure if you're really interested in pediatrics, you do some rotations in, electives or sub-internships, observerships, or tele-rotations, even anything, everything counts. Of course, like hands-on clinical experience is really important. Once you're a graduate, you can't do electives, so observerships also like are really good. In my case, I have done a lot of observerships because I was already a graduate. By the time I realized I will do EUSMLE, so it helps. Some observerships, like they let you do hands-on clinical experience, and it's okay if the attending is letting you, take history, or it's okay, you can do it. And I will also strongly suggest to do these kind of rotations in preferably in university setting. Clinics are also good, outpatient clinics, but university settings are really good because the letter of recommendation has a good impact if it's coming from a university setting. So please be, careful. Try to reach out, email coordinators. You can find email address for the coordinators in the FRIDA. I don't know how many of you are aware of this. There's a website called as FRIDA, FREIDA. It has, if you go into that and search programs, you just type whatever specialty that you're looking into, and then you'll get all programs, and then you can reach out to the coordinators. They have like all the email addresses there, and reach out to them if there's any observerships. With COVID, I know things have kind of, been all over the place, but things are getting back to normal now. I know some programs that offer observerships, like University of Miami, like it's a full circle. I did an observership there a few years ago, and I'm going as a fellow now. So that place also offers, and it was really good. Cleveland Clinic has a lot of good electives. Mayo Clinic has electives. So doing like really good programs. But if you don't get anything, that's okay. You can still do tele rotations, or even like, in private clinics. If you know anyone through your family member or someone, get into something. Something is better than nothing. So just make the best of what you have, and you can explain the same in your interviews as well. If they ask, hey, you're interested in pediatrics, why have you done, like, nobody will ask you, but even if there's an interviewer that asks, you can always tell, I made the best of what I had. So make sure you do rotations in pediatrics, and be very proactive during rotations, because faculty will observe how you're performing. Be proactive in terms of like coming on time to your rotations, like as like a resident, maybe the sign out is at 6 or 7, be there on time, do good presentations, and uh, do like case presentations in, for example, you saw a patient with asthma or like bronchiolitis or DKA or something, just do a quick presentation on that, and people will appreciate that, and they will include that when when you ask them for a letter of recommendation. They will definitely include those traits and good strengths that you have. And LORs from pediatric faculty is really important, because I think you have to apply at least 3 letter of recommendations, or at least, I think the maximum is 4. Make sure you have at least a couple of the LORs from pediatric faculty, at least 2 or 3. If it's FM, if you do FM rotation, that is okay too, because in FM you do see some pediatric patients as well. So try to get at least 2 pediatric faculty, like letter of recommendations, preferably from your core faculty or your dean. I mean, like the head of the department from your home country, and you can use some letters from the US. So do that. And coming to research, I did my research for a year in pediatric cardiology in Mayo Clinic, and I did it for a year. It definitely did help me a lot for my residency application and also my fellowship. I was always inclined towards cardiology, so it helped me in that sense. Some people might not have made up their mind what they want to do, but research is always good, because everything is evidence-based here. So you need to get that experience to be able to like analyze research articles, and to be able to incorporate that into your daily practice. So having research really helps. There's a lot of institutions like Mayo Clinic, Cleveland Clinic, and John Hopkins and Harvard. I had to email like a lot of, it's not an easy job. Like a lot of professors I remember emailing, and some of them will reach out to you saying, hey, we don't have any spots, but that's okay. just keep trying. Because I got into Mayo, I can give you some tips how you can apply for research there. There is Mayo Clinic faculty directory. If you Google that term, and it directly takes into the faculty directory, and then you can open up all the professors. They're listed in terms of alphabetical order. You can open each of their profile and see what they are into, like what fields. Let's say you're interested in pediatrics, somebody is doing. It's not about the expectation that others have from me. For me, it's all about. I think somebody was talking. Okay, so never mind. That's okay. We'll get back. And so if you go into research, Mayo Clinic faculty directory, you can look into their research. And if you're interested in their field, pediatric GI or pediatric cardiology or anything, just email them. And from my experience, I think emailing during like December, January, maybe February is the best time, because people will match and leave their spots. And they will interview new candidates at that time, so it will be the best bet to try emailing those people. And Mayo Clinic also sponsors like J1 Clinic research visa, so it will be easy. So if somebody is really interested in doing research, please apply. It's a really, really good opportunity. And in that sense, if you start and have some publications, even if you don't have publications by the time you apply, even if you started doing something, you can discuss that during your interviews, like what you're working. I'm speaking from my personal experience. My program director is also a pediatric cardiologist, and somehow it, his interest, my interest lie the same. So you don't know, maybe one of the interviewer that you will talk to during your interview might be interested in your research, and that will open up a conversation, and they will remember when they're ranking candidates. All of those things matter. So research really helps, not only for your application, but also like further down if you're aiming for competitive specialities for your fellowship. So the fruits will be, what do you say, like you'll get those fruits later, but having that experience really helps. And make sure you try to do at least like a case report or poster presentations in any conference. Having something is better than nothing. So I highly recommend to do those. And can we go to next? Yeah. So coming to the application, personal statement, I think it takes really a long time to come up with like a story and write and proofread. So if your application begins like September 15th or so, then you have to be starting your writing your personal statement from at least like May, like 3 months in advance, so you have enough time to like proofread it multiple times. And also when you write it, make sure you read some examples online to get an idea and feel for it. Describe scenarios, like instead of saying, hey, I'm hardworking and good at multitasking, so describe like a scenarios to point out your strengths. It can be medical related, or it could be something else too, like you're running a business, or something that you're doing, and that will show your traits automatically. You don't have to like explain. So it takes a lot of time to think, because it's really hard, I think, sometimes to come up with what your strengths are. You don't realize you have them. In my case, it helped me. I asked my mother what she thinks my strengths are. So it really helps talking to people. They will give you some ideas. So please make sure you prepare ahead of time, get it proofreaded multiple times, and always describe why you want to do pediatrics, of course, because that's really important. And for your CV, don't make it too long. Just write like at least 3 to 4 lines of what you have done in your work experience, research experience, or volunteering experience. And it can include, like, say, I have done case presentations and have seen so and so cases. You don't have to like all these weird like random cases. It could be like asthma, bronchiolitis, because people want to know that you can manage these commonly seen presentations. So, and have done so and so presentation on nephrotic syndrome or something like that. So write at least like 3 or 4 lines about your experience. It need not be super long. Having volunteering experience is really good, because people here love volunteering. And if you do something in pediatrics, well and good, or if it is anything that is really good, anything is better than nothing. Again, it could be like COVID, you have been like a frontline warrior. You can write all those things what you have done. It opens up a conversation. And again, prepare ahead of time, proofread multiple times, make sure there's no spelling mistakes or grammatical errors or nothing like that. And so I think that should be good with CV. ERAS application. So make a list of programs in advance where you want to apply. I think as an IMG, if you have like really good scores in 250s and 260s, more than that, then that's good. Maybe you can apply selectively, but people with like average scores, I think it's better to apply broadly everywhere. And like I said, Frida is a really, really good resource for finding list of programs that you want to apply, and it has all the information about each program, like what visa they sponsor and all of that stuff. Sometimes it can maybe not be updated, so it's better to always look into the program's website. But make sure you make an Excel sheet of programs with the sponsor J1 or H1B, or who's the program director, what their email address is, where is this place, and all of that stuff. And I have done that even for my fellowship. It really helps segregating things and making it less confusing. And always apply on time. Make sure you have all your letter of recommendations and everything. I forgot to mention it in my earlier slide, but make sure you get your letter of recommendation well in advance, because ERAS takes like, I think, a week or 10 days to process it and to approve it and show it on your application. So make sure you give a heads up to your faculty or whoever is writing your letter, like well in advance. And so everything, you have all your personal statements, CV, letters, everything on time, because people will be like, okay, this candidate is genuinely interested, and that will give you leverage like on getting more interviews and things like that. And letter of interest emails, I think it's really helpful, especially for the ones you really want to go there. And if you really like the program, just include just send an email after you, maybe like 1 or 2 weeks after you apply, so that they know that this candidate is genuinely interested. You can also send letter of interest emails before you apply as well. And that also helps, because that will be showing as if you are like really interested into that program. And when you do so, include why you're interested in that program. So research about that program, write at least like 2 or 3 points. For example, the curriculum, or the mock code curriculum, or somebody like the didactic curriculum is really good, or like how what do you say, like they have all the subspecialties like in the hospital, something that you're interested. Just include like a few points why you're interested in that program and why you're interested in that place. Why do you want to move there? If you have any connections or like family or ties or something, just include all of those things in the letter of interest emails, because they do remember if you send. Most of the programs like such kind of letters. I know nowadays everybody is sending, but still make sure you do your job and include why you're interested, like at least 3 or 4 points. That's really important, rather than sending like a generic email. And always be courteous and polite in emails and interviews. Be it program coordinator, because they also have a say sometimes in programs while they're ranking. Be it program director or faculty or PC, the coordinator or residents. Always be courteous in your emails, and very, very prompt in responding to them. And networking also plays a big role. Try to attend conferences like AAP or Pediatric Academic Society. If you're already in the US, you can attend these conferences. I think the next AAP conference coming up this October is in DC, Washington. So, if you're around that area, maybe you can go there. I think I was looking into the prices, and it's like $25 for like students. So you can always like make a subscription and like register for the conference. There you can meet program directors, residents, and introduce yourself, and it gives you an opportunity to talk. And and there are some programs, they like just come there to showcase their program. So make just make it like it's a good opportunity to talk to PDs and introduce yourself and make connections. And attend virtual tours and open house sessions. Now that most of the interviews are virtual, most programs are hosting like virtual tours and open house sessions, and you will know more about the program, and you can ask questions, and you can meet other people, you can see how they're talking and what kind of questions they're asking. There's always so much to learn in these sessions. So join these open house sessions. Even if you don't get an interview from that program, just join to get a feel for it, see how system is in the US, and things like that. And you can always connect with people on Twitter or LinkedIn, and email. Most people don't respond, but some people do. So making connections, you can do that way as well. And can we go to the next slide? And so, most importantly, like interview tips. When you get the interview, know the program in and out before your interview. Like research about the place. Why do you want to go there? What made you move there? And what made you apply? Make sure you have all of that information written down, like in small bullet points in a book or something. I don't know how interviews are going to be this year, if it's virtual or in person. But if it's virtual, then you can keep a book beside you, and then you can have that ready. So prepare answers for commonly asked questions, and this is really important for any specialty if you apply, and not only for pediatrics. Practice, 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 like in front of the mirror with your friends, and practice in such a way it's not rehearsed too, because you don't want to be like as flowy as possible. So tell me, just it could be just be like 4 to 5 lines, because you want to give the interviewer also a chance to talk and engage in the conversation, rather than like just you talking one side. So the answers have to be like really short, in like maybe 1 to 2 minutes, maybe 2 minutes the most. Tell me about yourself, not more than that, because the interviews last for about 10 minutes with each interviewer. So you need to have questions to ask and them to talk and all of that stuff. And why pediatrics? You're going to mention that in your personal statement, but again, you can describe more elaborately. And why that program? I discussed a few things earlier. So why that program? You look into the program's website or the place and everything, and your strengths and weaknesses, and what you're going to bring to the program. This is really, really important. Make sure you discuss like strengths, how you're going to write in your personal statement the same way, like telling them a scenario, explaining your strengths in that way. And weaknesses, we all have weaknesses, so don't say that I don't have any weakness. Just tell them anything genuinely, whatever you have. For example, public speaking, or it could be anything. You don't think that they will judge you. It's okay, just be true and honest. That's something that everybody appreciates. And tell them what you're doing to overcome that. And everybody has weaknesses, so never say that I don't have weaknesses. You can just say one or two, and then say what you're doing to make it better. And sometimes some programs may ask behavioral questions too, here and there. Not so common in pediatrics, I think more in IM, but still, like pediatrics, do you come across behavioral questions? So they can ask you like, oh, tell me about a time where you had to deal with an adversity, so how you overcame it. Or tell me about it. Or if they will give you a scenario saying, you want to do like a test on a patient, and then your senior or your nurse is like telling you not to do it, or what you're going to do in that situation. So prepare for these kind of questions, how you want to answer, and be ready to answer these questions. And anything you mention on your CV and personal statement, be ready to answer it and describe it. Do not like fake anything at all, because that shows up. I mean, you have to have, well, I will say you should not fake anything. It's not, you just be honest and true. That's really important. And always have at least 2 to 3 questions in mind to ask the interviewer. So once your program coordinator sends you, interview like agenda and all of that stuff, so they will give you who are the candidates, or who are the attendings that, or like the people that are going to interview you. So Google them and see what they are. If there's a critical care doctor, or if it's a hospitalist, or if it's a GI doctor, see what kind of research or things that they're interested in. And you can have a conversation, and that way they will connect with you. And ask questions about the program, from genuinely from what you couldn't find anything on the website that you want to know. For example, you can ask questions like, are there any opportunities for like community volunteering experiences, or you can ask something like that. And you can ask like research, how the research curriculum is, what kind of support they have to do that, and mentorship, how's the mentorship in the program, and things like that. So have at least two questions at least in mind. You can ask the same question to different interviewer as well sometimes, so you can learn different like perspective from each of them. So always have questions to ask. Never say that I don't have any questions, I heard, I got to know. There will be one or two questions you can ask. And the communication with the program, always be polite and courteous and prompt, of course. And I think sending handwritten thank you email cards will be appreciated. And if you can't do that, if you're in India, I know this is like really tough and you can't do it, it's okay, you can send a thank you email, but do it so within the 24 to 48 hours so they remember you. And again, you can send another email before like ranking time, like why you're interested and in that program, and that you had such a great experience and things like that. So send emails because people really like, and you can also send like happy new year emails or Thanksgiving emails and things like that too. That is also helpful. And one last thing I want to say before I conclude, everybody's story is unique and different, and people will help you, people will not help you, but you have to trust your instincts. Everything is like a experience and a journey. Don't lower yourself down. Always chin up and be confident and be strong. IMGs are important part of the workforce here, so you will get through it, if not now then next year. So don't lose hope, and I wish everyone the best in whatever subspecialty or field that they are going to choose. Thank you.
Thank you so much, Dr. Banala. That was a very insightful session. I'm sure every one of us here benefited from it, especially the pediatric aspirants. So Shanti, would you like to introduce the next speaker?
Yeah. So next up, we have Dr. Himanshu Sajja. He is a graduate from Osmania Medical College, and he's currently a PGY2 Internal Medicine Resident at Cleveland Clinic. Hello, sir. Would you like to take over?
Yeah. Hi. Are you able to hear me?
Yes.
Okay. Hi, I'm Himanshu. I'm one of the residents at the Cleveland Clinic main campus, and I'm a graduate from Osmania, as I was introduced. I graduated in 2018, and I joined my residency in 2021. Do you want me to share the slideshow?
Yes, Himanshu.
I think most of the things I wanted to talk have already been discussed, so I'll quickly run through and then we can open it for questions. So I was going to mostly talk about the maths season, how it goes, and what all, what is the timeline, what is the best way to go through the maths season in my experience. And this is purely just my experience. It's different for everyone. So starting with the timeline, usually it starts the tokens. You can start getting it as it shows in June 7th. That is when the application opens, and the first thing I would do is to start thinking about the LORs, sending the request for LORs, and then the application you can start submitting it on the 6th of September, but 27th is when you need to get everything ready by 9 a.m. because the programs download everything by then. You can go to the next slide. So the main components of the application are the ERAS application, which is also known as the CV, and personal statement, LORs, MSP, the certification, and the transcripts. And there's a new thing called the supplement application, which I have no clue what it is because it started the year next. So I will not be able to talk about that. Next, coming to the CV, it's actually the most important part of your application. it's mostly to highlight whatever achievements you have. If you're applying this season, you're almost close, and there might not be a lot you can add in the next 1 or 2 months. So highlighting whatever you've done till now. Everyone does a lot of things, and you just have to highlight them in the CV. In each work experience, don't just put like few words or just 1 or 2 lines. Try to explain whatever you've done, even if it is a small thing. Any procedures you've done during your internship, anything you've done during your externships, like presenting a case during morning reports, or if you have come across anything interesting in the US experiences, you can just mention it there, and try to at least get 3 or 4 lines with each experience. And do, as it says, don't fake anything in the work experience, because everything you write it there, they'll definitely ask about that during the interview. So don't fake anything, but also don't be very brief, and like don't cut out anything that you've done. So mention under each and every work experience, mention at least 4 points. Research experiences, you can you don't have to mention all your studies or any research papers there. You just mention your the mentor whom you work with, and then you write what all projects you worked on and what kind of things you've done in the project. Like I've done the IRB proposal, I've done the research statistics, I've learned the statistics, how to do it. And then I've also done the paper writing. So you can explain more there in that section as to what part of the research was done by you. And then the volunteer experiences, it coming from possibly I think most of them are from India and from Telangana, Andhra Pradesh. So we might not have a lot of volunteer experiences, but most of the things you've done during your internship, and you might have attended a blood camp, blood donation camps. So try to add in as much as possible, even what like experiences like Osmicon conferences. People have asked me about that. So I add in those which shows your leadership skills and and others. And awards and certifications, any medical school awards, you can put it there. And certifications, like you can add in, there's a section for ALS, BLS and ACLS, but you don't have to have those certifications. And publications, there's different sections where you can do peer-reviewed journals, non-peer-reviewed articles, then book chapters. So there are different sections where you can add all of these. And there's also a section where you can put in for if you've written an article for a website, you can put in those too. And if you've submitted something and it's not been published, you can add it in the submitted list. And so you can have multiple articles, even if it is not peer reviewed, that's fine. And hobbies and interests, it's one of the most crucial part of the CV, because this is where they ask you questions in the interview. So make sure you don't fake. That is my strong suggestion, is not to fake anything there in the hobbies and interests. Even if you have like 1 or 2, that's fine. But no, like if you're genuinely interested in something, they will definitely ask you about it. I've heard people ask someone to sing a song if you just said I'm interested in music and I sing. So they've asked you to sing. If you say I'm interested in like stand-up comedy, they've actually might ask you to also like tell a joke or tell a situation or mimic someone. So this can happen. So don't fake anything there. And every your CV, you have to know from the first line to the last line, and they can ask you from any part of the CV. They will sometimes a few interviewers will go through each and everything and each and every section, and they can ask you detailed questions about it. So be prepared for it. And personal statement, my view of personal statement, it's again my view. So it can hurt you more than it can benefit your application, because what the programs might will be seeing is how is this applicant as a person, what's his personality, and so from the personal statement, if it is, the only thing you should do is make sure that they see you as like um, who might not be a team player, or any negative traits shouldn't be coming out. They shouldn't view you as a weird person, if you say. So make sure you don't portray yourself that way. But there's no format to the personal statement. So people have not talked about anything related to medical stuff. They've talked everything about other things they've done in life and what it shows as their personality. And that is totally fun, totally good, and then actually better if you frame it in a way that describes your personality. But if you don't have anything, it's very normal that you might not have like anything eccentric, or you might be just simple like everyone is. Even I didn't have a lot of things to say in my personal statement, but what I did was whatever, like I wrote down, these are the 4 traits of me I wanted to showcase to the interviewers or to the program. And I've framed my personal statement in a way that these all of these traits show up without me saying it, using the adjectives. So uh, you can adding in experiences or examples is very good, like situations, but don't add more than 1 or 2, um, and be like brief in those. Try to limit the whole personal statement to 1 page. And then the other thing is the first and last para are the crucial part of the personal statement, because if it's just like, if you come across an article, you first read the first para, and if you're not interested, you don't go forward. And then, so what I did was I create something interesting. Don't mention any quotes. That is a big no. Don't mention some quotes from some famous person unless it really means something to you, and you can explain it throughout your personal statement. So I connected my first paragraph and then the last part of the personal statement, so that it shows how I started and then how I ended up, and how it shaped my view in medicine and internal medicine. So you can, if you're applying to internal medicine, you can write about what makes you interested in internal medicine. Without saying I'm interested in internal medicine, you can just talk about the traits, what they usually see, what is needed in internal medicine. Internal medicine is more about like communication, is about more empathy, because you are in direct contact with all the patients. And surgery, it's a different ballpark. It's a different field. There you need more persistent, hardworking. You need hardworking even in internal medicine, but then you need more persistence and you need more like procedural skills. So those are the kind of things they look at. Internal medicine, it's you look more into like empathy, communication. So those things you have to make sure that uh, those show up, and you don't have to have like a lot, just 3 or 4, and focus on them. And I would suggest starting it early, so that you don't have to rush through the personal statement and then get very tensed at the end. So at least start 1 or 2 months prior to the deadline, and get it proofreaded by many like mentors, if you have any mentors in the US, or like if you know any residents or anyone in the US who've gone through this process, that will be a great insight. And also, even like your friends, if you show them and then ask them if it shows what you are actually. So they can give you good inputs if it is actually depicting what you are in person. And using their, like, people ask me a lot of times about professional services. Is it beneficial to use those services? I think you need to have a draft. It's beneficial to use the services for, like, if if you want it to be more polished and like showcase whatever you want to say, but don't uh, rely on anyone to write the whole person statement for you. I've had people use like the services to write the whole person statement. So what I've seen they do is make you write the questions. Like they have 10, like 20 questions. They make you answer all of those, and then they just put it in paragraphs and connect those. So I felt it was not like that great of a service. But if you're struggling, yes, you can use it and then you can edit it later on. But I would say start by yourself, and then you can use services on Fiverr. There's a website called Fiverr which freelances. So I've used one of them, but um, when I gave it to them, they said you have to change the whole person statement. This is not the way it's to be written. I said I'll not change it. So I didn't use their services. I wasted money, but I didn't use their services. So this is the other important thing. If someone says, "Oh, this is not conventional. You shouldn't be using it, like doing it this way," if you have to change the whole thing, take it with a you always have to trust your gut. If you feel that this is how you are as a person and you want to showcase it, if there's any issues with the English and grammar, then that can be changed. But if they ask you to change the whole thing, and then if they're asking you to do it in the conventional way, you don't have to. So just ask multiple people if they think the same way. If multiple people are thinking the same way, then maybe you have to change a few things, but you don't have to change the whole thing just because someone said or some mentor said. It's totally personal statement is totally up to you. Some people here in my colleagues, they didn't even show it to anyone in their like prior to applying. So, and then LORs. So most of the programs, they don't mention how many you can upload, maximum of 4 to each program. They don't mention, they said just minimum of 3. A few programs would say 3 letter LORs, apart from the dean's letter. So what I did was I had 4 letters, so I just sent all 4 letters apart from the dean's letter. And to those programs, we just asked for 3. We had a list. I made it with my friends who were applying. So I just sent those 3 letters, like just 3 letters to those specific programs. But you don't have to do it. They don't. I think they'll just download 3 if they need. So you don't have to like do it in that way and have to do another step of identifying those programs. Then coming to US LORs and home country LORs, people ask me this too, if you have to upload these or do you want home country? I think a few programs will definitely ask for a letter from the department chair or department, like if you're applying to internal medicine, like the chair of medicine at your home country med school. But most of the programs didn't specify anything specific. So I just sent all US LORs. The benefit of having US LORs is the chance that they might know this person and they'll trust that LOR more better than someone from India who's writing an LOR, which they might not know. So I think the trusting and at least here, if you get the LOR from a US medical doctor, then it'll be beneficial because they will know what kinds of things people look for here. So it'll showcase that you have all of these things you need for an internal medicine physician in the US. So I think US LORs are definitely good. Then university versus like outpatient clinics or non-university LORs. I think university LORs are good in a way that there's a chance that person knows. For example, if you get an LOR from a clinic in New York and you're applying to a program in, just say, South Dakota or Omaha, they might not know this person and they might not know the clinic. So they might not give a lot of weight to that LOR. But if you get a letter from, let's say, NYU, or if you get a letter from Mayo Clinic, if you get a letter from Cleveland Clinic, then people know what Cleveland Clinic, Mayo Clinic, and NYU are. So you can, they'll actually trust those LORs more, just because they know that they know these universities well. But if you don't have it, that's totally fine. Having something is better than not having any LORs. Having US LORs is the most crucial part. Doesn't matter if it is university or clinic. If you have university, that's well and good. Even if you don't have, that's fine. And then coming to if the LOR should be written by someone like a big name versus someone you worked for more time and knows you well, I would say definitely for residency, take it from someone who knows you well than taking it from like a chair of medicine at this big university like Harvard, where you work with them for like few days and they might give you the most generic LOR, which might not help you a lot. So I would say take those LORs too, but have at least one LOR from a person who can actually write about your personality. You work more with that attending, even though he's like a new grad or has like just graduated from residency and started as if he's like an assistant or an associate professor, that's fine. But have at least one LOR where they actually personalized it to you. You can go to the next slide. So the other parts are the MSP medical school transcript, which you get it from the med school. You don't have to do a lot of things for that. USMLE transcript, again, they automatically pop in. ECFMG certificate, I would say have it before the deadline. I think 27th is the time where programs start downloading. So have the ECFMG certificate ready by then, because most of the programs would prefer, whenever every program has their own filters while filtering out the candidates. So the ECFMG certificate is one filter most of the programs might have. So I would suggest to have it. Even if you don't have it, don't like. I've had people say I won't apply this year because I'll not have the ECFMG certificate by then, but you don't have to have it by then. So don't postpone the application by 1 year just because you don't have the ECFMG certificate by the deadline. Just apply. You can email it later to the program saying I'm certified by ECFMG, and you can notify them through an email to all the program directors. Program coordinators. So that's not a big thing, but preferably before the deadline. And one thing is about if you've not yet graduated, start with the degree, because getting it up certified and getting it uploaded by the ECFMG will take a lot of time, especially for the degree. That is the most time-consuming thing in the certification process. So make sure that is in early, so that even if you have the step 2 is pending, if the degree is certified and it's they've accepted the degree, then it will take you will get the ECFMG certificate the same day or the next day of the result of CK. So you don't have to wait along for ECFMG certification if the degree is already approved. And then researching the programs is one of the most important things. I would say I didn't research the programs well enough before applying. So I just applied whatever others were applying. And I did have regrets about it because I didn't apply to a few programs because they were not in the list of others. So I thought I should have researched them. You don't have to research them in detail, but at least have a look at what IND percentage they have. Even if they have like 1 or 2%, then there's a chance that you might get in if you have like connections or if you by any chance know someone, or maybe they like something in your application and you can possibly get in. So I would suggest applying very broadly. So researching about programs prior to application, just like maybe 5 or 10 days prior to the deadline is totally good, totally fine. You don't have to start doing it pretty early. And then after the deadline, the application, the most important part is to prepare for the interviews. Preparing for the interviews, I think most of you will be having those questions, the interview questions, like most of the interviewers ask. The most important question is, tell me about yourself. That's your elevator speech pitch. So you need to crack that, and you need to put it in a way that it is not boring to them. It shouldn't be going for more than 2 or 3 minutes. It should be limited to less than 2 minutes, but it should that question drives your interview, the whole interview. So they would follow up that question, by whatever you're telling in the tell me about yourself part. So you need to tell it in a way that you want to drive them to a specific direction that you want to take the interviewer to, and make them ask those questions, and so that they can know you much better, and then they mostly focus on your strengths than the weaknesses. And then letters of interest, definitely you need. It has helped me because what I felt was you have like there are 4,000 or 5,000 applications to each program, and there's no chance that each program can review all of those. So they'll have a certain filters. Even after filtering, many of the applications get lost because they have very less time to go through each and everything. So they might get lost. So the most beneficial things is to send a letter of interest. Mention why, as Keerthana already mentioned, make sure you research the program and have at least 1 or 2 lines regarding the program as to why you're so interested in the program. And what I did was I sent it to the PD, associate PDs, and assistant PDs. So send it to how many ever people you can find in the leadership of the program, so that even if one of them sees and they feel that you might be a candidate, then you can get the interview. And it has happened to me. Once I sent in the letter of interest, the next day I was getting interviews. So it really helps if you send it, but don't send it like the next day of once applied. So just give them at least 1 or 2 weeks for them to start reviewing. What I was doing is there are Reddit pages where I used to see if people are getting interviews from the specific program, and I used to then send them emails, or then thinking that, oh, these people have already reviewed, so they started sending. So then I used to send a letter of interest. But you can send it early, but at least give 1 or 2 weeks, like post the 27th. Then scheduling the interviews, I would say schedule it. You need to be very good with scheduling. Most of the times you will have options, and so schedule your top programs in mid-season. Don't schedule them too early. Don't schedule them very late, thinking that you will get more experience. But at the end of the season, you'll get like very exhausted, and you won't be very active during the interviews. So schedule them in, like, I schedule most of my top programs in December, end of November. By then I had a few interviews, so I was pretty much ready for them. And then during the interview day and the pre-interview, so what are the most important things? Are you need to research the program well, go through their website, and see what all they've written about the program already in the website, and make sure you have know your interviewers. Most programs will tell you like you're interviewing with this person, so you can research them and see if they're like what are their interests. Are they interested more in teaching? Are they interested in QI? Are they interested in any are they from like subspecialties and are interested in a specific branch of the subspecialty they are in? And you can ask them maybe like questions not directly to them, like not directly related to it, but you can ask them, for example, if an attending is more into like QI, then you can ask them question as to how is the QI curriculum, how is the research in QI, and how are residents involved in QI at the program. So then they can answer it well, and then you'll have like good conversation. So I think researching is good. And then always, if you have 2-3 interviewers, have at least 2 or 3 questions for each interviewer, which are different. Don't ask the same questions to all interviewers. If they talk among themselves, then it'll look very bad. So ask different questions to each of the interviewers. And also sometimes, most of the times it's like 15-minute or 10-minute interview. Sometimes the interviewers ask any question. They'll just say, I've gone through your application, it looks good. I just let me know if you have any questions. So then prepared even for those scenarios where you have to ask them questions for like 10 or 15 minutes. So you have to drive all the time you have. So make sure you have enough questions even like in background. If you come across these situations, make sure you have like 5 or 6 questions for backup kind of thing. And then post-interview communications. So post-interview, most of the programs I've interviewed, they said don't like we don't answer any of your query, like we don't answer any of your thank you emails. If you have any questions, we'll definitely answer, but we don't answer any of your thank you emails. And a few programs and don't send us any cards, don't send us any emails. So if they say no, don't send them anything. Just not even like a thank you email. But if they say that's fine and we just don't reply, then you can send a thank you email briefly about whatever you talked about and what you liked in the program, and send it early, like 1 or 2 days. And then thank you cards, once again, it's good to send it. It's up to you. You don't have to do it, but if you do it, I don't know if it adds a lot to what you've done, but it's definitely shows that you're more interested or have more gratitude. Otherwise, post-interview, there's also one question about should I let them know that they are the top programs, top choice in my match list. Don't send like to every program that you're my first choice. Don't do that because it looks very bad. If by any chance they talk among themselves, then it will impact very badly on you. So just what I did was the first 3 programs, I just first program I said you're my top choice. The other 2 programs I said you're my one of the top choices, and I just sent it to 3 programs. So you don't have to send it. It's better to not send it and say that they're like one of the top choices or one of the and one of the top choices, because a few programs will view it as, oh, he didn't rank me first, so they'll rank you like lower. So I would say first 3 you can send them, but you don't have to send it to everyone. The other thing, the other topic is about like questions about how to match into competitive programs. So this matching into in any like top programs is not any different from matching into any other programs. It's just if you the most important thing is because these programs have a big size and they have graduates mostly coming in from the US medical schools. So whenever they review your application, they won't even have enough, like they won't even have time to review all the applications. So if you've worked in those programs specifically, for example, if you've done observerships, clerkships, and it'll be definitely beneficial because you will know someone in the program and they can put in a word for you. And that way, at least your application will be viewed by the program. But otherwise, there's nothing much different from other programs. So just the difference is quickly going through between university affiliated and community programs. So I feel going to university will help mostly in the fellowship process if you want to go to like competitive fellowships, and the universities have in-house fellowships, and in that way you will have better chance in getting matched. Otherwise, compared to like very big universities, I think of a few community programs you get trained in internal medicine much better, because you get more autonomy. You don't have like fellows running everything, like even in like subspecialties when you do subspecialty electives, or uh, in like cardiology, if you do like I make you ICU, if you don't have like community programs, they don't have fellows, so they will get more autonomy and they can they'll be more responsible for the patient. So I think you can get trained better than a few university programs. Having that said, having university is definitely beneficial in your CV down the lane whenever you apply for jobs or in your career. So it's not the end of the road if you don't match into a university. That is my what I wanted to let you know. And then you also come across like bigger programs like with 50, 60 size. Like our program, there are like 55 residents in each class. So you might, and because it's a very big class, the downside is you might feel that you get lost in the crowd, and you might not know everyone. Not everyone in the program knows you well. There are instances that the program director might not know you that well compared to other smaller programs. But here we do have like advisors or different assistant PDs, associate PDs, where we can talk to them and they know us better. But the benefit for smaller programs is because it's a small size, you will have like good interactions with all the attendings, all the leadership. So if you have any issues, you can directly go to them and then talk to them and get their advice, which might be difficult in like bigger programs. And is research compulsory to match into competitive like programs? Not necessary. Research helps definitely if you have any research, but if you've done electives in those programs and you get good letters, you get someone who can put in a word for you. Research is not, I've seen people, IMGs match without research. I didn't have any like publications by the time I applied, so I don't think it matters that much. But if you have it, it does benefit. But it is not one factor that says, yeah, this is a candidate or he's not a candidate. Networking is, I would say, for these programs, it's most important. If you have someone who in the program, or at least like a resident or a fellow who can put in a word, at least so that they can see or look at the application and decide if they'll be a good fit, that'll be a great benefit. So try to like reach out to people who are working in the programs, like alumnus in the programs, and try to see if they can put in a word. It might be difficult for them to put in for like multiple people because then they won't, like the program won't take their word seriously. So try to reach out to them early during the season so that they can put in a word. But otherwise, if you've done electives, that is the most important part in these programs. Or if you've done a research like research year in those programs, like done research at Mayo, Yale, then you have a better chance in getting an interview from Mayo or from Yale and matching there. I've known people who matched at Yale after doing a research year. So that gives you, because you know people from there, and then they can put in a strong word, and that goes a long way. So that is the most important. Choosing the program again is important because when you go for a program with very high reputation and it doesn't fit to what you want in life, then it might not be a great choice as going for the reputation. But if you want to go to like for fellowship, like cardiology or gastroenterology, and you can look at their match list and see what is how they've done in the previous classes in matching there. But if you have like preferences with location or visa preferences, H1B versus G1, then I would say write down your priorities, and then when you rank for the programs, make sure you rank it and based on your priority, not based on the reputation. So just make a priority list as, is my first priority like location because I want to stay close to my family I have in US, or is it more I want like H1B, J1, or is it more reputation or fellowships? So make sure you have that in mind before ranking. And in the process, I think scores do matter. You right now, because step one is just pass or fail, so the CK score does matter. But if you can get pass having less low scores, but if you have good connections or networking or good LORs, but if you have good scores, then that's definitely a plus. But not all programs need like 250s, 260s. I've known people who matched with 230s, 240s into competitive residency programs. So don't worry and try more to network and try to get more connections and do more observerships. If you're targeting a specific program, do observerships or clerkships in those programs. And medical school reputation does matter. But again, this is not because you can't change that part of your application. So don't think that I'm coming in from an unknown school. Coming in from India, most of the schools except AIMS are unknown to people here. So it doesn't really matter a lot. So don't worry about the medical school reputation or the scores. If you have it, that's good. But even if you don't have it, don't think you're not a competitive candidate, because there might be other aspects of the application which make you a better candidate than someone with like 250s or 260s score. And LORs, as I said, try to get if you're applying if you've done observerships in that specific program, getting an LOR. And the most important thing is to having someone put in a word or at least send an email to the program director saying he'll be a good candidate for our program. That goes a really long way. And at least those things will get you an interview. After you get an interview, it's totally upon you as to how you showcase yourself during the interview. And then it again depends on, you need to have a bit of luck because sometimes you might even after getting the interview and doing it so well, um, you might not get selected. So that's again, you need to have some luck. Try to apply to more, if they have like tracks, try to research on those tracks and apply to different tracks too, so that at least if you are interested in some track, and uh, you can email them saying I'm interested in this specific tracks because of these and these, and because you're showing interest, they might offer you an like the interview, and then they'll probably if they like you, they'll give you a spot. And that's pretty much what I have, and we can open it to questions.
Thank you, Dr. Sajja. That was a very informative session. Um, if anyone from the audience have questions for Dr. Banala or Dr. Sajja, you're free to ask.
Guys, you can unmute yourselves, or if you're not comfortable with that, you can put your questions in the chat box. I think we have 2 questions.
I can take the first one. Year of graduation. So I was 3 or 4 years, I think, out of my graduation by the time I like matched. So I don't think it's a big deal, honestly, as long as if you as long as you're doing something or the other to improve your CV and there's no gaps. By gaps, I mean you don't have to have like gaps more than like 4 to 6 months. That's gonna look like you didn't do anything. Even if it's volunteering or research or something, make sure you fill something in that. But it's not difficult for matching at all. I have known even like 10-year grads as well matching into good programs. But again, everybody's story is unique. But it's I don't think it's difficult to match. You have to apply broadly and make sure you do rotations around the programs that you are aiming for. For example, some states are more IMG friendly, like Newark, New Jersey, Pennsylvania, Michigan, and Florida. So make sure Texas too, and you can do some rotations there in and near the hospitals, or if it's good if you can do a rotation in that program itself if you have some connections or something. And I don't think it's difficult to match. You can certainly match. Of course, like you can research programs if they have a strict cutoff year of graduation less than 3, maybe don't waste your money and apply to that programs. But most programs they kind of holistically like review the whole application.
I can take the next one. Having step 3 by the match time is not even a consideration. No, the programs don't even look at step 3 for the whole match season. The only thing it matters is if you want to have H1B visa, you need to have the step 3 by I think by the time you match the match week. So sure you have the step 3 done if you want H1B. Otherwise, I don't think it matters if you have step 3 or not. A few programs I heard in New York or New Jersey, which are very intensive programs, they would prefer you to have step 3 so that you don't have to take time off during the first year to prepare for it. But I don't think anywhere else it matters. They don't even ask you about step 3. Just these programs which are very intensive workload wise. And then regarding my point of university affiliated and community based, it's just what I wanted to say is each and every applicant thinks matching and university is like the most important thing, and matching in a community based program is like a bad thing. But in my match list, if you'll see, I've ranked a few community programs higher when you compare to a few university programs. Just by having the tag of university doesn't get you, doesn't say that it is a very good program. And what I wanted to say is university programs just give you a boost if they have like an in-house fellowship. And if you want to get into those fellowships, then you can have a better chance. Otherwise, it doesn't matter down the lane. If you come from like the top tier programs, top universities like Stanford, that high programs, yes, it will. But otherwise, it doesn't really matter. If you want to become an internal medicine physician, do hospitalist, going to a university or a community-based program doesn't really matter down the lane. And I can take the next one too. Is it advisable to apply broadly or just prefer IND-friendly states or programs to increase the probability? I would say if money is not a limiting factor, then apply to as many programs as possible. Even apply it again based on how confident you are in the application. As IMGs, I think having at least like 100 programs is good, but most people apply to more than 200. So if you apply for less programs, you would get less interviews, and then you would feel more tense during the whole season because you're not sure if you'll be matched or not. Then that will cause you more anxiety. But if you definitely think that I won't be happy if I go to these programs, or my point of coming to US is to get into these prestigious institutions, then yes, you can apply selectively, but I would say to match and to be safe, I would apply broadly and apply to, unless you have strict no's to a different specific location, I would say apply to most of the locations. Is it better to get geographical preferences or write about urban or rural preferences in the ERAS application? I'm not sure. I don't think there's a specific preference in the ERAS application unless it is in the supplemental. I'm not sure if this is a part of the supplemental application. If Keerthana, you know.
I'm not quite sure about that, but I heard you can pick like 5 programs, I think, where you, I don't know what the term was. You can pick like 5 areas or something like that. Honestly, sorry guys. I applied like 3 years. I matched in 2020, so I applied in 2019. So I might not know information, but I heard from some of the medical students, there's like, I think 5 programs that you can say that they're your favorite programs or something like that in the application. But I think when you mention like your address in the ERAS, like the CV, you can say that you have some connections in that area, and you can write in your letter of interest emails as well. But I don't know if there's any particular part in the ERAS application where you can mention specifically. But I think applying broadly to most of the IMG friendly states, as you can see, I think Himanshu already mentioned really good points about that. Is really important, I think, and don't waste money unnecessarily. So my advice is to apply broadly, but also like keep all factors in mind based on like your preferences and your choices. So
Dr. Banala, like, is there a number for the number of programs we have to apply for pediatrics? Like for internal medicine, we usually consider 200 plus is a good number.
yeah.
Is there something?
There's only what, like 2,900 programs or something for pediatrics. Sorry, positions. I mean, what am I saying? Sorry, positions. So I think there's like 150 programs or 180 programs, something like that. And I applied maybe 120 programs or 120 or 130 that sponsored J1 and H1B. So, and you can also see on Frida how many IMGs, like, the percentage of IMG residents in that program too. There's like in the Frida website, if you go to each program, some of them have statistics like how many of the residents are IMGs, how many of them are US grads. Some programs have, not every program. So you can apply based on that as well. So.
I think there was a question about IM versus neuro, which one is easy to match. I don't think there's a easy answer to that question. It's again because neuro has less number of spots. That's why people apply to IM. And neuro is like it's mostly like a subspecialty right now. So not everyone is into neuro. Not everyone likes neuro. So I think that's why people apply more into IM, which is more broad. But coming to more competitive, yes, because neurology is mostly it is offered in university programs, not like community programs usually don't have neurology fellowship, residencies. So because there are less number of spots, obviously they'll be more competitive. But anything, having said that, it's not very difficult to match into neuro too. You just have to have clerkship or observerships in neurology, and don't keep it like as a backup, because neuro, you don't like any residency, they won't like that you were keeping their specialty as a backup. Even if you apply to family medicine, you need to have some rotation in family medicine. You can't say, oh, I did all my rotations in internal medicine and now I'm interested in family medicine, because it doesn't make sense in the application. Then they will know that this you're like the backup. So I would say if you're applying to some, at least have one or two rotations in those specific specialties.
And if I may add, our founder of Let's Talk USMLE, Dr. Sai Reddy Banala himself is an incoming neurology resident. So you're always free to reach out to him, and I'm sure he would help you if you're someone confused between internal medicine and neurology.
And then I think there was a question about, I think I'll be missing a few questions. How many months of USC are considered compulsory? I don't think there's a compulsory kind of thing for the application. It's just you need to get the 3 or 4 LOS. So I would, if you prefer everything from the US, so you need to get 3 LOS. So it's very difficult to get 3 LOS in 1 month rotation. Sometimes you can, if you have like 3 different attendings coming in the same month, where you work with one of them for 2 weeks, the other 2 attendings for 1 and 1. So if you get all the 3 by the first elective, then you're good. Or else I would say at least if you do 2, then you will get a good number of LOIs, because the first week coming from a place from India where we are not well versed with the EMR, so it'll take some time to get used to the EMR and actually to do something or at least impress them. It won't be enough to do it in the first week. So I'd say so for the first month, you probably might get 2 LORs. So at least if you do 2, you'll have like safe number of LORs. And I think Salman asked about meeting the PD during the elective. How do you approach the meeting? So when I was doing my electives, I've not met. I didn't get a chance to meet any of the PDs, but it's definitely better to meet the PDs when you're there for the elective. You can reach out to them and schedule a time for the meeting. During the meeting, I would focus more on how you like the elective, how you like the people, and express the interest in the program. Try not to be very desperate, or just try saying that you're interested, you like the program very well, and you'll be happy to come here, or if given a chance, you'll be happy to come here. So just let them know that you're interested, and once you tell that and how it went well, it'll be a conversation between him and him or her with you about how like if they want something, like if they want your CV to be given to them, have your CV ready by then, so that if they ask you for your CV, then you can have it. Sometimes PDs take the CV, and when you apply, they will give you the interview very early because they know you, and if you work with them, that is great, and they'll definitely give you an interview. But even if you reached out to them, talk to them, and they have your CV in hand, then they can give you an elective the interview. So I would say just be casual and don't stress a lot. Don't be tense. Don't showcase yourself. And the communication is the most important part. So be confident and just be casual, saying I'm interested in the program and I like these parts of the program and these people I've worked with.
I think Syed Rizwana asked about a question regarding USC. If you give step 2 in July, and okay, so yeah, if you're giving step 2 in July, I think yeah, anything is possible, honestly, but you need to have more US clinical experience, and also letter of recommendations need to be uploaded. I don't know if that will be enough time to apply everything. You need to get your certificates and LORs, so I think there's a time constraint there. My advice is to apply next match. I don't know, Himanshu, if you have another opinion, but don't rush into things because it is so expensive to apply. It's you have to spend so many dollars. So my advice is to take one step at a time, do rotations, do research, and get letter of recommendations and apply. Because if you give your step 2 maybe a little early, like in March, maybe you'll have enough time to prepare, because writing personal statement, CV, and getting your LORs, it's not an easy task. I think personally, from my standpoint, and everybody has a own experience, but it's what I would suggest.
Yeah, I agree. It would be like you'll be rushing a lot because it's very close to the deadline. Um, and if you can't like spare 1 year, definitely you can try to apply. And if you have the personal statement earlier, like before like July, and have it ready by then, and then again you have USC in August, so you need to get the like first work, impress them, get the LORs, and they have to be uploaded at least 2 weeks prior, sorry, 1 week prior to the deadline, because it takes some time for them to process those LORs. Having that said, you don't have to have everything by the 7th, like the 27th. It's not like a must. It's just that if you don't have any LORs by then, the probability decreases that the programs will review your application, and a few programs won't even download your application late if you apply late. So it'll just decrease your probability. So if you definitely want to apply this year, then you can go ahead, get everything ready by then, like CV, personal statement ready by July, and in August focus more on the USC because you definitely need the LOR from that experience. So I would say it'll be difficult, but maybe you can try. I personally would apply next year if it was me. And someone asked about case reports as research experience. Um, I think you might not, you can put in case reports in the published section, publication sections, but case reports in doesn't come under research experience. But you can, if you have like systematic reviews or those, you can possibly put it in research, saying you worked with this particular mentor and worked on these projects or these systematic reviews. But I'm not sure if case reports would be apt in the research experience sections. You can definitely put them in the publication sections, but I don't think it'll be apt to put it on the research experience. Can you match without any connections or networking? I would say networking and having connections is very critical, but personally, I didn't even here in Cleveland, I didn't have anyone put in a word for me. It's just, it seems when I sent the letter of interest, the program director emailed the attending who worked with me and who wrote me a letter, and he talked to her. But otherwise, you don't have to have connections or networking to match. But having said that, if you have it, there are more chances that you will match, because at least you are, if someone puts in a word, your application gets reviewed. Getting your application reviewed is the most critical part of the whole math season, because if you have 3,000, 4,000 applications for each program, there's no chance that every program reviews your application. But at least if someone puts in a word, they'll look at your application and see, okay, he meets our criteria or he meets our checklist, and we can give him or her the interview. So I think having connection will get you the interview, but after the interview, it's up to you. So I would say it's not the end of the road if you don't have networking or connections. You can purely get interviews based on your application by itself. And the other thing you can do is sending letter of interest and having a very short CV, so that they can look at the CV and they can decide in the email uh, if you are a good candidate and possibly review the application.
Also, you can reach out to the alumni of your institutions if you already have someone from your college that is already doing residency. Not everybody helps in this journey. Remember that some people do, some people don't. It's okay. Just don't take it to heart, but try to reach out to as many people as possible. And you never know who will help you. And if you have any family here that knows doctors who are working in a hospital, maybe they have connections. I have done all of that stuff. So if you try 100 things, maybe one or two may work for you. So just try to reach out to people. As seniors are the best bet, honestly. So having connections helps, but it's not like a big deal breaker. People match even without connections too, but it definitely adds an advantage. I have not done electives, so I don't know if Himanshu, you can answer that question about electives.
Oh, electives, I don't think there's a specific month. It's electives happen all the year, and they usually put it on the website as to which what months, if they have any specific months for IMGs, they'll put it on the website. But I don't think there's a specific month where electives, because it's just like the spring, the fall season. So you can review the websites to know much better.
Next question about pediatrics. Personally, I think looking into the websites and emailing the coordinators, and if they mention that we do not offer observerships of electives, then that's fine. But if there's nothing, maybe you can always email, especially like I said, IMG friendly areas. If you target those programs, if you do a rotation in a nearby university hospital, and you can try to get into that program, or other community programs around that, because people know each other and they can rely on that LOR if you get from that place. So try to target those places. I know there's some private organizations who offer rotations and stuff. They're really, really expensive. My suggestion is to try by yourself and keep them as a backup, because this process is so expensive. So all these opportunities I've heard and I have done myself. The organizations, they provide opportunities, but they're mostly in clinic setting, and that attending is maybe affiliated to that hospital, but you don't necessarily always have that experience working close to the residents. So keep them as a backup. For example, you mentioned AMO opportunities. Keep them as a backup, but my suggestion is that you email them. There's a lot of programs that offer observerships. You can so you can browse through Facebook forums for the USMLE electives group C, because things have changed a lot recently after COVID, and so people post and upload. So look into that, see where people are, rotating, and apply to those programs. So always emailing, send a small email with like a short CV is really helpful. So I have done my rotations in University of Colorado for like I did for 2 months, and in pediatrics, and I did in University of Miami for a month. And I did few rotations in like clinics too. So having, I think, mix of that also helps you increase your knowledge to see how outpatient setting is and how inpatient setting is. So email the coordinators. I think that would be the best bet, and keep the private organizations as a backup. If you don't have those opportunities, you can always go for this one. If you didn't get matched in one go, I honestly don't know if they can remember in the next round or not, because I'm being open and honest. I did not match the first time, but I matched the second time. I did not have any issues there. So I don't think it will be a drawback. It's okay if you don't match. It's not the end of the world. There's always light in the end of the tunnel. So I don't think it will be like mentioned in the next round application. I didn't have any of that. So it's okay. Family medicine or psychiatry, good choice for IMG. I think family medicine needs more experience in IM and PEDS, or like even working with a family medicine doctor. I know that working with medical students, most of these medical students from here, they favor FM more. Family medicine, this recently it has become more like what do you say, like US grad. I think they're liking to go, but you can definitely try FM or psychiatry. I know people who matched into FM and psychiatry. I think you all know Jason Manchuri. He's like a big IMG mentor kind of thing. So you can definitely match if you are really inclined towards. So make sure you do electives and rotations and have your CV prepared, focused towards that specialty. But I think it is a good choice if you want to do that, because there is a need for psychiatrists in the US, and also FM doctors too, because people, we want people in the outpatient setting. So I think it is a good choice, and you can definitely match.
I can answer this question about the externship and observerships. I think observerships are considered USC. It doesn't matter if there are like observerships or electives, unless the whoever is writing the LOR writes like good points, like personalized LOR, and writes in how what he or her she liked in you. So I don't think it matters if it is an observership or an elective, and they are considered definitely USC. And most of the programs, I'm not, don't quote me on this, but they might not even know what an observership is and what an elective is.
I do not think pediatrics is like challenging to apply. Honestly, if you have genuine interest, I'm pretty sure you will get like a lot of interviews and you'll match to a good program. I am not sure why people prefer me I am more than pediatrics. It could be lifestyle, or people are interested in adult medicine, various things. I cannot say about that, but I don't think pediatrics is like the toughest field to match in. I think in fact, I think people put a lot of things into consideration maybe when they apply. And there's only, like I said earlier, 3,000 spots, and I think IM is like 9,000 or some 8,000, 9,000 spots. Is definitely more spots in IM compared to pediatrics. So maybe when you see the applicant pool is less. Last year, I think the 400 IMGs matched, non-US IMGs matched into pediatrics. So there's not many people who apply. I am not quite sure why, but it's not difficult. If you have application focusing towards pediatrics, you can match to a good program.
I have a question for Dr. Sajja. Sir, what do you think played a major role in helping you match at Cleveland Clinic, since it is considered to be one of the very competitive programs?
Yeah, I think the most what helped was I did an elective in the clean clinic, so I got an LOR from here. And as I said, when I sent the letter of interest, they talked to the attending whom I worked with and wrote me an LOR, and she put in a good word for me. And I think that helped me to get an interview. And then once I got the interview, I think the interview went very well, and I think that's the reason I matched into clean clinic. But again, there's also a factor of luck, and clean clinic is one place which really takes IMGs and views IMGs and as an important part of the residency program. So I think if you want to match at the clean clinic, I would suggest doing at least observerships or like elective, because they give interviews to most of the people who do the electives here. So as said, any like big good competitive programs, or if you do electives, or if you know someone from there who can review the application, and if you get an LOR from there, will definitely have better chances of getting an interview. And then matching is again a different thing. You sometimes need luck to go in your favor and have everything set up good. Yeah, getting and doing the elective is the most important.
The criteria for acceptance into Cleveland Clinic elective, is it first come first serve, or do they select students based on CV?
I have no idea as to what the criteria is. When I did my electives in 2019, yeah, 2019. So when I did the elective then I don't think there was any criteria specifically, but we were thinking it is first come first, but no, it doesn't. And I've seen people in Team Clinic, they try to get into any of the rotation, like even surgical rotations, and then try to get another month in like medical specialties, but they've stopped doing that because they understood that people are doing more of these. So they stopped giving another month of electives. But I'm not sure if there's a specific criteria. But if you have someone who can reach out, like I've put in a word for a few people, but again, it's very restricted and as to how many we can put in a word for in a year.
Tips for rank order list. I think once you're done with interviews, just write all the points that you like about the program make an again Excel sheet, the place, location, and the program itself, what you liked about the program, a curriculum, or for example, if the program has in-house fellowships that you want to go into, or if the program has like all the subspecialties like in-house that you can rotate. Based on that, and if it's a H1 or J1B, if you're inclined towards whichever visa, so include that, and based on those things, I think I would rank my list of the programs that I interviewed. Some people have like geographic ties to some, having a family or something. So keep those things under consideration when it's the same for any specialty, I think so.
If we do not have any more questions, I think we can conclude the session.
Thank you. Good luck, everyone.
Thank you so much, Dr. Banala and Dr. Sajja, for your time. And I found this session very helpful, and I'm sure other attendees did as well. And thank you so much for your time. It was very insightful, very informative.
Thank you for
Thanks
taking
for
time out of your busy schedules to do this with us.
Thanks for having me, and all the best for everyone who's applying this year.
Thank you, Dr. Sajja. So yeah, this is the end of the session, guys. I think we can leave now, and you can follow our page for more updates regarding any future sessions. Thank you.